Great, so I think we'll get started. Good morning, good afternoon, and good evening from wherever you're joining us from. My name is Liz Colway, and I'm the Director of Community Building and Digital Engagement at the Sabin Vaccine Institute, which hosts the Boost community. I'd like to welcome everyone back on behalf of the Boost community and the World Health Organization to the second session of the COVID-19 Recovery for Immunization Programs Fellowship, in which we will cover closing immunity gaps in recovering immunization programs through the life course and integration. Next slide. Before we get started, I want to go over some logistics for today's session. First of all, if you would prefer to listen to the session in French, we encourage you to select the interpretation button in your meeting controls at the bottom of your screen. You should see a globe icon. We have also included step-by-step instructions on the screen on how to access interpretation, either through your computer or mobile device. I also just wanted to introduce our interpreter for today's session, Monique, who I believe might come off or come on to video for a second, just to wave to everyone. Okay, great. Next slide. So during the session, you can engage in dialogue with your peers and session facilitators through the chat. We also ask that you use this forum to ask any questions throughout the session as well. Once we get to the question and answer section of today's session, you may raise your hand to feature or to voice over your question if time does permit. Finally, please remember to rename yourself. You can just right click on your name and make sure that you have your first name, your last name or family name, and country so that we can record your attendance for today's session. Also a reminder here that this session is being recorded in both English and French. The recordings along with today's presentation in both languages will be provided to attendees early next week via email. Next slide. So I'm joined today by our session facilitators, Erin Wallace, who's the team lead of the Immunization Delivery Science team at the U.S. Centers for Disease Control and Prevention, and Laura McLaughlin, who's the technical officer of Life Course and Integration for the Essential Program on Immunization at WHO. Next slide. For today's session, we will again go over the fellowship objectives and expectations. We'll reflect on some key takeaways from session 1, and then we'll go ahead and dive into the main topic for today's session, life course and integration. And then we will end the session with some Q&A with the audience and our session facilitators. Next slide. So I want to go ahead and kick things off with a poll question. So if you don't mind, please tell us what region you're joining us from. I believe one of my colleagues should be launching the poll, and we'll give you about 15 or 20 seconds to answer. Great, I think we can go ahead and share out those results.
All right, so the question is, what region are you joining us from? We had 62% from the African region, 5% from region of the Americas, 21% from Southeast Asian region, 3% from European region, 8% from Eastern Mediterranean region, and 1% Western Pacific region.
Perfect. Thanks so much, Aisha. Appreciate it. Next slide. So again, I'm going to go over the fellowship timeline and expectations briefly. I know we went over this last week, and we'll continue to touch on this at each session. But again, this fellowship will run from May until the end of November. In this first planning phase, which runs through the end of June, you will attend 8 mandatory weekly live engagements led by subject matter experts on topics relating to recovering, building resiliency, and strengthening immunization. During this period, you will be asked to reflect on the topics addressed during these live sessions and consider which track you'd like to take for the remainder of the fellowship. So we ask that you select one of 2 tracks during this period, which are outlined on the screen. So in track A, you'll write a prospective strategic proposal for COVID-19 recovery activities. And then in track B, you will write a retrospective review of COVID-19 recovery activities that you've previously implemented. So please note that a template will be provided to guide you through devising a strategic proposal or documenting COVID-19 recovery activities. And we expect to have the template ready to share by next week during session 3. So regardless of which track you choose, you will be required to attend all live sessions, submit a post-session survey after each session, which we'll share with you the link, and then submit your proposal or case study in order to receive a certificate of completion. For the next phase, which will be from July to November, if your strategic proposal strongly addresses recovery, or if your review strongly addresses recovery goals, you will receive mentorship to either implement your proposal and write a case study documenting the experience, or write a case study documenting the experience in the case of track B. Next slide. So on this slide, we just wanted to preview some of the upcoming session topics. We've received numerous questions during the first session that were related to these featured topics. So we will hold on answering those questions until those sessions take place. So be sure to bookmark these sessions. They're available as calendar invites, I know, through the Boost Learning Group, and we've also shared through an Outlook calendar invite. So again, all this information will be available after the session in both the learning group and follow-up email. Next slide. So in the meantime, you can visit the learning group via the Boost Community online platform, which is at boostcommunity.org, to review any previous session materials, including a recently added frequently asked questions document based on some of the top questions we received for the fellowship so far, as well as answers to relevant questions from the first session. So all of these materials were posted to the resources section of the learning group. Please note that we have received several requests for the French translation of last week's slide deck. We're still working on that and expect to have the slide deck translated into French by the end of this week. And again, we'll post it here in this learning group, and we'll also share it out via email. So moving forward, you can expect to have these materials shared as soon as we have them, but there may be some delay. And we do thank you in advance for your patience. There are also more details on how to use the learning group in the About section. We will be posting reflection questions, as we have already, after each session to the group forum. So we do strongly encourage you to join that group, and I've highlighted the join button on the top right-hand corner of your screen in order to follow along. And if you do opt in to join the group, you can receive notifications on a daily or weekly basis of all the group activity. Next slide. And also just a reminder that we'll be using a Boost Telegram channel to quickly engage with our peers and fellowship facilitators, troubleshoot technical issues, and receive session reminders. You can also always email us at info@boostcommunity.org in case for some reason your questions are not answered in those spaces. Again, we greatly appreciate all those who have stepped up to answer questions of your peers in both of these forums. Next slide. So before I hand it over to Laura, I want to acknowledge that more than 100 comments that we've received in the learning group forum in response to the reflection questions from session 1. Next slide. While I can't read them all out loud here, I do want to highlight a few responses. I do, however, encourage you to visit the forum in the learning group to post your own response and read some of your peers. And you can also comment or begin a conversation there. So our first question was, what do you hope to achieve with this fellowship? Again, highlighting a couple responses on the screen, we had Mr. Faudet say that this fellowship will improve my knowledge of immunization post-COVID-19, because during this fellowship, it will create an opportunity to interact with other immunization professionals, thereby making our great ideas infectious. And the knowledge gained will be used to improve on immunization service delivery in my area of responsibility. We had Ms. Jamaya, who said this fellowship will help gain more skills, knowledge, and understanding requisite in implementation of recommended strategies that result in successful vaccination coverage targets. In addition, she hopes to identify innovations that can be leveraged upon having zero-dose children and achievement of 100% fully immunized children if possible. And I know we had some comments in French as well, and I might hand it over to Lara to maybe summarize those responses.
Hi, everybody. So we had a comment from Dr. Mamet Tahina from Madagascar, who was saying that this training will really help improve the action plans they developed to implement routine immunization strengthening. And they're looking forward to the peer-to-peer exchange that will happen during this fellowship training, which is great. And then also we had Dr. Kandiani from DRC, who said that there was support needed to develop microplans in order to monitor routine immunization services, and that many health centres at the moment don't have plans or know how to support developing plans in order to monitor and evaluate their programs. So this training hopefully will help them to do that.
Great, thanks so much, Lara. Next slide, please. And then the other reflection question that we asked was, what is the main problem impacting your immunization program, and how do you plan to address it through the fellowship? So we had in Nepal, majority of people here are accepting regular immunization and COVID-19 vaccines as well. However, there still seems to be a major gap in recording and reporting, so it becomes difficult to see the reality of full immunization coverage and to follow up on missed vaccination. And through this fellowship, I intend to dive deeper to look for strategies to address these issues and come up with a solution that is sustainable. And then we have from Ms. Ma Elenda, health worker fatigue affects the current outcome of our immunization program. For more than 2 years of battling COVID-19 pandemic, most of them are already overwhelmed of tons of tasks that they need to do. And by joining this fellowship event as a sub-national program manager, she hopes to learn from the different insights of my fellow participants and recommendations of expert speakers on how to boost and gain back the loss of confidence of our frontline workers. So a lot of comments around interacting with peers and learning from peers, which is wonderful and what we hope to facilitate through this fellowship. And then maybe over to Lara once more.
Yes, so Dr. Makam Yavari from DRC, they seem to be facing an issue with misconceptions about COVID-19 vaccination and how this is leading to some misconceptions and hesitancy around vaccination. So they're hoping that this fellowship will provide them with updated knowledge and skills to try and address that situation. And then also from DRC, Dr. Tem Demdu, he was mentioning that there are problems at several levels, not just relating to infrastructure, but also personnel, financial resources, and also lack of planning and equitable distribution of vaccines. And in particular, the absence of micro-planning and good denominator data leads to really difficulties and problems with trying to communicate about the importance of vaccination.
Great, thanks again, Lara. Next slide. I think that's it from me. I just wanted to thank everyone again for taking the time and energy to join us on this learning journey. And we do appreciate everything that you do to lead immunization programs in your communities. And we look forward to supporting you throughout this fellowship. So over to you, Lara.
Thanks, Liz. So I think before we get started into this week's session, I think it's good that we just recap a bit on what we covered last week. So last week, we covered catch-up vaccination and reducing missed opportunities for vaccination. So on the next slide, we can see that it's important that we know the definitions of what we mean by catch-up vaccination, MOV. So last week, we were saying how catch-up vaccination refers to vaccinating an individual who is missing doses for which they are eligible per the routine immunization schedule. And then when we look at missed opportunities for vaccination, this is any contact with health services by an individual who is eligible for vaccination but does not result in vaccination. So these two session topics that we covered last week are very interrelated, because sometimes we see that people who are eligible for catch-up vaccination access health facilities and actually unfortunately leave because of a lack of awareness by the health worker or the caregiver or some other health system issue that may lead that person missing out on getting those vaccines. And I think one of the key things around catch-up vaccination is about eligibility of vaccination. So I think that's an area that a lot of health workers or even caregivers are not aware about, that they or their child are eligible for a vaccine. So that sometimes is why we see drops in coverage, because sometimes people who are accessing our services are not getting those vaccines they need. Next slide. So I think one of the key takeaways, or the main key takeaways from last week, was that there's an urgent need to catch up and reduce any missed opportunity for vaccination. I think it's particularly important at this moment in time because we want to try and ensure that all our population are protected, that they're not susceptible to vaccine preventable diseases, and that we can reduce any future outbreaks of any of these vaccine preventable diseases. So in that, countries should aim to implement or strengthen catch-up vaccination strategies, and also understand reasons for missed opportunity of vaccination and implement strategies to address this. Next slide. So today we're going to cover life course vaccination and integration. So I'm going to go through life course vaccination, and then my colleague Erin is going to go through the integration aspects. So next slide is going to be a question for all of you. So there's a lot of talk of life course vaccination at the moment, but what do we mean when we talk about life course vaccination? So if you can go to the chat and enter what you think life course vaccination means, or if you want to say that you don't know what life course vaccination means, that's fine, because we're going to discuss it here today. So we'll give you a couple of minutes to just put what you think life course vaccination means into the chat. Okay, so see that some people are saying vaccination at every stage of life, or vaccination beyond infancy. Some people are saying they haven't heard the concept before, so that's great that you're here. Yeah, so some people are saying that they don't know, and that's great. This is why we want to try and have this session today. So vaccination throughout life, all ages. Okay, this is great. So vaccination every age. Very good. So thanks everybody for those comments. So life course vaccination is a topic that we're going to be discussing today, and it's a topic that's very important at the moment, given that we're delivering vaccine to people at every age. So in the next slide, when we talk about life course vaccination, we say the life course approach to vaccination extends the benefits of vaccines across an individual's entire life. So previously, many of you, would have been aware that pregnant women would be eligible for vaccination, newborn and infants. But with life course vaccination, we're expanding vaccination beyond infancy. We're looking at how we can establish contact points whereby people who are older than infants can get vaccinated. So we have platforms beyond infancy, which include the second year of life, children, adolescent, adult, and older persons. Next slide. And we can see that these specific, what we call platforms, are very important, and they have specific vaccines that are recommended. So what we have here is we have the whole life course, where from pregnancy to older persons. And within that, we see that there are contact points or vaccines that are recommended. And it's really important that we understand that there are certain times when we can get certain vaccines, but also as part of catch-up vaccination, that many people are eligible for vaccines across the life course. One thing I want to point out to you is if you look in the right-hand corner here at adults and older persons, we see that there aren't many globally recommended vaccinations, or there were not many globally recommended vaccinations previously. But in the next slide, we'll see that with the introduction of COVID-19 vaccination, now we have a vaccine that crosses from childhood all the way up to older persons. So this means that we have new contacts, we have new opportunities to vaccinate populations that we didn't have before. So this poses benefits and also poses some challenges, because you have to think about how you can reach those people. So we'll talk about that a bit further. But just to say that life course vaccination is an opportunity whereby we can extend vaccination beyond just infancy. And it's a very equitable way to vaccinate, because we're ensuring that everybody has access, equal access to vaccines. Next slide. So I know last week, Samir touched on the Immunization Agenda 2030, and this is the new strategy, the global strategy for immunization for the next decade. And as part of this strategy, the vision is it's a world where everyone, everywhere, at every age, fully benefits from vaccines for good health and well-being. And this was endorsed by the World Health Assembly and member states and partners. And this is really something that many of you may be working on as part of your regional, national or subnational plans to really try and see how you can address and adopt this Immunization Agenda 2030 for the next decade. Next slide. And as part of IA 2030, there are 7 strategic priorities, and they're based on 4 core principles. But if you look at the one that's highlighted or circled in green, there is a specific strategic priority for life course and integration. So over the next decade, this shows that the importance and how we can build strategies to really expand life course vaccination and increase integration is really something that is going to be focused on countries and to ensure that it's people-centered, that it's country-owned, partnership-based, and data-guided. And all these strategic priorities interlink with each other, but the main overarching theme of IA 2030, or the strategic priority that's overarching, is immunization for primary healthcare and universal health coverage. So this is how we want to ensure that we have equitable access and that everybody is able to benefit from vaccines. Next slide. So as I mentioned, within IA 2030, we have a strategic priority 4 that is dedicated to life course and integration. And the goal of that strategic priority is that all people benefit from recommended vaccines throughout the life course, effectively integrated with other essential health services. So this is where we see the interlink between vaccination and integration and life course. So it's a nice way to think about vaccination and life course and integration, because we're looking at how we can bring these together to ensure that when people access our services, that they have vaccines available, but potentially we can integrate it with other services. So if they're coming for another reason, that they can also get vaccinated. Next slide. And the objectives of this strategic priority 4 is that we strengthen immunization policies and service delivery throughout the life course, including for appropriate catch-up vaccinations and booster doses. So we can see here how life course and integration interlinks with what we discussed last week about catch-up vaccination. By having policies in place and having service delivery contact points across the life course, this means that somebody who may be eligible for a vaccine at a specific point in time, their increased chance of getting that vaccine if there is policies in place, if there's a platform established, and that person could be protected from a vaccine preventable disease. And otherwise, if we didn't have these policies or platforms in place, then this person could be missed. So that's why it's important that we have very strong policies in place and that we establish these platforms so that vaccines can be delivered across the life course. And this is why we also want to emphasize the objective of this strategic priority is to establish integrated delivery points of contact between immunization and other public health interventions for different target age groups. And I think for many of us, this is, I suppose, a new concept if we work in immunization or not, because what we know at the moment is that many programs work alone. They work in a vertical way and they don't really communicate with each other. What this means is that one intervention or program may have an intervention on a specific day and they'll require that person to be there on that day. Then another program may have an intervention on a different day and require the same person to come on a different day. So we have to really start thinking about the people that we're trying to deliver these interventions to. We're putting a lot of expectation on people and also on our health workers to have repeated visits with people when actually we could actually have a more integrated approach and where people could have multiple interventions delivered during their same visit. So I know that some countries are doing really excellent work to try and strengthen and improve integrated approaches to vaccination. And they're doing that by working together with their programs and also considering other contact points outside of their typical routine systems to reach these people. Next slide. So when we talk about life course vaccination, here's a poll question. I want to ask you, we looked at the slide back there where we showed all the vaccines across the life course, but what do you think is the global extent of life course vaccination? And I will say that this proportion we're going to share does not include COVID-19 vaccination. So we'll see now what people think, but we'll give you another couple of seconds there to see. But I think most people are erring on the side of it being lower. Someone's saying that they think it's less than 30%. I think we'll have a look at the responses now in a second, but great. So Aisha, do you want to?
Yes, so 49% responded with 49%, 23% responded saying it was 59%, 17% responded it's around 69%, and 11% responded that it's 79%.
Thanks, Aisha. So I'll show you where we're getting this indicator from and what the result is, but it's a little bit higher, but that's because we're focusing on specific platforms. But this will be without including COVID-19 vaccination, but it's actually give or take 69%. So on the next slide, I'll give you an indication of how we estimate that. So as part of IA 2030, we have an indicator to look at the extent of life course vaccination. It's not a perfect indicator, but I suppose, we were developing these pre-COVID-19, but we look at breadth of protection. Now, this will become clear in a second, but when we talk about breadth of protection, this looks at the global average of coverage that is achieved by a certain number of antigens that are recommended across multiple age ranges. And we get this information from the WHO and UNICEF estimates of national immunization coverage. So the list includes from polio to measles. I'm not going to go through all of them, but we can see the list below. So it includes a number of vaccines from infancy up to adolescence. And that's how we look at the global breadth of protection. So in the next slide, what we see here is an example of what's been happening in terms of breadth protection, or the extent of expanding vaccination across the life course over the past 20 years. And we see that in 2000, the number of vaccines that were available were low, and the coverage was below 80%. And over time, we've seen an expansion and a broadening of the breadth protection over the past 20 years. Now, what we will say is that the increase in the breadth protection is mostly driven by introduction of new vaccines. So that's how we're expanding this, which makes sense, but there still is opportunity for improving that. So it's just showing you that, this is a spider web way of trying to depict the coverage, but we're seeing that over time, there is improvement and expansion in the breadth of protection. And we hope that when we get idea of the coverage of COVID-19 globally, that we can expand and expand on this graphic. But in the next slide, I'm going to show this by region. I know these are a little bit small, some of these figures, but you can see that there's a lot of difference in the different regions, as you can see. So in the African region, progress has been made, like quite drastic in progress in the past 10 years. So that's great. In the Americas have quite a well-established life course vaccination. So they've been improving over the past 10 years. And in fact, every country is really seeing expansion of the breadth protection over the past 10 years. And what we hope is for the next decade that this expansion will continue to happen. And not only that the expansion of vaccination will happen, but also increased coverage is really what we really hope to see over the next 10 years. Next slide. So many of you may be wondering, how can life course vaccination help with COVID-19 recovery from an immunization program? So how can a country improve their immunization program by taking a life course approach to vaccination? So in the next slide, what we want to make a point about is life course vaccination is a strategy that encompasses both closing immunity gaps and recovering immunization programs, because you're able to catch up people who may have been missed by ensuring that you have platforms established across the life course. And it also strengthens routine immunization and builds resiliency. And what we mean by that is that by having platforms established across the life course, it means that in the event of needing to roll out a new vaccine, you already know how to reach these people. So it helps you to kind of prepare for future vaccine introductions which may be required if there is a future unknown epidemic or pandemic in the future. So just to say that this approach is very important. It's very important for your program, but also it also helps build your program, strengthen it, and also ensure that there's equitable access to vaccines for all. Next slide. So not only that, but this kind of summarizes that, life course vaccination prevents death and disease across age groups. And that has major knock-on effects for your community and population, because we have people who, don't have disease, they're not accessing tertiary care, they're able to live life and contribute to society. So it's very important. Reduces burden of disease. It also strengthens primary health care and is an integral part of IA 2030. As I mentioned, life course vaccination is an integral part of the strategy for the next 10 years and will become part of regional and country level strategies going forward. So altogether, life course vaccination has very great potential to protect populations, reduce disease, and strengthen health systems. Next slide. So this is something quick in the chat that I want you to have a little think about. So what do you need to consider for a life course approach to vaccination? So if your country currently does not have vaccines beyond infancy or beyond childhood, what would you need to do or consider to have a life course approach to vaccination? So people are saying having strong policies, health workers, knowing your resource and your target, sensitization and training, exactly, training, comprehensive action, policy and HR. Yeah, no, these are all surveillance, exactly. It's a very important point, surveillance, good point. And sensitize amongst communities, excellent. No, these are great points people are making in the chat. And also someone saying training at the high level, which is very important, and sensitizing communities, great. So on the next slide, we just have some key considerations when transitioning to a life course approach to vaccination. So as many people mentioned in the chat, identifying and reaching target populations. I think that's a lot of things that, that's a very important point that I think we really got to learn during COVID-19, considering that many countries wouldn't have vaccination for older adults. So it's really about how do you identify and reach target populations, but not just older adults, but people who typically do not access our health services. Others also mentioned integrating with other services. That's very true. By integrating with other services, that allows us to, I suppose, put less pressure on our immunization program, but also have a more people-centered approach and allow people to access other services at the same time when they're accessing immunization. Another very important point is recording and tracking data. So the home-based record or our vaccination cards are very important. If we're going to have life course vaccination, it may mean that that person may need to keep that record for longer. So we need to ensure that people have access to their records, that they keep their records safe, and also that they bring them to every health opportunity. And that was another point that was made last week. And then also at the health facility level, ensuring that they're recording and reporting these data that are provided. Also, life course allows for catch-up of missed vaccinations. And in order to do that, it's very important that policies are in place so that health workers know when they can provide catch-up vaccinations and that they know what the populations are that have been missed. So I think these, again, are important points. Also, it was mentioned in the chat about building acceptance and demand. That is a very, very, very important point. And I think many countries, I'm sure, are facing this issue of trying to increase demand generation. And how can you do that? I think that the main thing is there's lots of communication required and ensuring that communities are aware of what's happening. I think that communication is key. And also we want to ensure that there's equitable access, that we're not missing out on those that are not accessing services. So Samir will talk next week about zero-dose communities. So we want to ensure that there's access to vaccines for all. And then finally, the financing and advocacy part is a key area, because we need to ensure that we have sustainable financing to actually provide the vaccines, purchase the vaccines, and distribute the vaccines. And also, as people mentioned at the beginning, or mentioned in the chat about advocacy, ensuring that there's high level support from leadership in order to deliver live course vaccination. Next slide. So we're going to go through some examples of life course vaccination, and I'm going to pass over to Erin, who's just going to give some examples from Ghana and also on school vaccination. Next slide.
Thanks, Laura. So to provide a bit of an example here of the life course work that Laura has been describing, this is an example of an activity that we provided technical assistance to Ghana Health Service on. And it's a really nice example of a country initiating a approach to life course vaccination, which is establishing a second year of life vaccination platform. And many of you have likely been encountering establishing second year of life vaccination platforms in your countries as one of the first opportunities to be delving into the life course vaccination approach, and certainly the 2IL work, or the second year of life vaccination platform building, is an example of a life course approach. So in Ghana, they introduced a second dose of measles containing vaccine in 2012, and this was at 18 months of age. And then they also introduced a Men-A vaccination a few years later, also at 18 months of age. And one of the first things that they did was they worked with their National Immunization Technical Advisory Group to endorse the introduction of both of these vaccinations in the second year of life. And this was really the first time that Ghana was introducing a vaccination and a vaccination visit beyond 12 months of age. So what this entailed Ghana Health Service to really focus in on was how to make this platform building successful in the second year of life. One of the first big things they did was they worked on a strategic plan. And in that strategic plan, they looked at those existing maternal and child health services that already were in place beyond the first year of life. And they saw that there were already existing growth monitoring visits and nutrition check visits beyond 12 months of age. And so they looked to integrate that the measles second dose and Men-A vaccinations with existing growth monitoring checks beyond the second year of life. They also wanted to take advantage of the fact that they were having these children come in beyond 12 months of age for these newly recommended vaccination visits, to screen them for any earlier missed vaccinations from 12 months of age and below. And so they revised their catch-up vaccination policy, and they did so by looking at what their earlier max recommended age ranges were. And they, in consultation with their NITAG, modified their vaccination policy to be able to provide vaccinations for those first year of life vaccines up to 5 years of age. And they then developed guidance for healthcare providers on how to screen and catch up children for those earlier missed vaccinations. They also worked on their health information system. They updated all of their paper-based and electronic registers and all the accompanying paperwork to ensure that they were collecting information for these new vaccination visits beyond the second year of life. And this really helped healthcare providers to know that they were going to be able to have a place where they could record these visits, and that they weren't going to be essentially potentially docked for providing these additional doses of measles vaccination beyond 12 months of age, but actually this was truly a second dose that was going to be provided, and not a just additional dose for children in the country. Then they also worked on mobilizing healthcare providers and caregivers. This was really a big identified barrier when all of this work began to strengthen the vaccination platform, that many caregivers and providers really felt that vaccination ended at 12 months of age. And so with these new vaccinations, there really needed to be quite a bit of promotion and rationale provided to both healthcare providers and then caregivers as well, to help them to understand why these new vaccination visits needed to occur to help reduce vaccine preventable disease mortality and morbidity. And then lastly, they expanded beyond their traditional partners for vaccination, and they reached out to those places where these older children could also be. And so they engaged with daycare outlets, or creches as it's called in Ghana, to train the creche or daycare owners on being able to provide vaccination messages to parents of these older children. And this was a very commonly used situation in particular in urban areas such as Accra. Next slide. Now, with Ghana as a case study and other countries that had been introducing measles second dose and other vaccines in the second year of life over the past decade or so, WHO put together 2 excellent handbooks on the introduction of a second year of life vaccination platform. And these are the 2 documents that you see in front of you. These guidebooks can very much serve as a template for the introduction of any age-based platform, as Laura had described. And I highly recommend that you take a look at these. Next slide. Now, vaccination checks have also become increasingly a common strategy that national immunization programs have been introducing. These vaccination checks are checks that commonly occur for children around entry to school, 5 years of age. And what this incorporates is really the fundamental aspect of catch-up vaccination, where children come in, ideally still have their vaccination card or some evidence of their immunization status, perhaps from the local health facility, and school officials are able to screen on vaccination status, and in conjunction with the local healthcare providers, they then can be referred for catch-up vaccination. And this really is a very critical part of, going back to the example of Ghana, the need to address the official catch-up vaccination policy, to be able to address what the max age ranges are that a country endorses for catching up children on earlier recommended vaccinations. Measles vaccination, for instance, being recommended in most countries at around 9 to 12 months of age for the first dose, and then 12 to 24 months of age for the second dose. So a 5-year-old being screened at school to be able to be provided that catch-up vaccination if they've missed it earlier, there needs to be a very clear and concise policy in place. And so WHO has been monitoring the introduction of these oftentimes school-based vaccination checks around the world. And you can see here on the map that this has become increasingly common across many regions. Next slide, and I think I'm handing it back over to, or I'll talk about this one as well. So for education platforms, there are quite a number of different opportunities to both promote and deliver vaccines. So school-based vaccination activities can occur where there are routine vaccines that are actually being delivered at the school location. And these are oftentimes sessions that are being run by the local healthcare workers, and they're administering the vaccines according to the national immunization schedule. The screening and catch-up vaccination strategy, which I described earlier, is one that is done oftentimes upon a child's entry to school, and provides this opportunity for a child who's missed those earlier vaccinations to be caught up, and thereby reducing the immunity gaps and reducing the chances for an outbreak of a vaccine preventable disease. There's also this opportunity, which was the example coming from Ghana, of being able to educate the school officials so that they can provide immunization messages that then can increase the awareness of the parents of those children that are attending the school. Integration is also another key component as well, and I'll talk a little bit about this in later slides, where the immunization activity should largely be seen as a component of a broader school health program, not just about screening for vaccination status, but screening for any existing and needed health interventions for which a child is eligible. During vaccination campaigns or supplemental immunization activities, schools can and are often used as a site for delivery of those vaccines through those SIAs. And then lastly, around outbreaks for vaccine preventable diseases, this, when outbreaks happen, can really act as a catalyst for implementing the screening on vaccination status and or providing vaccination as needed in response to an outbreak. Next slide. I hand it back over to Laura.
Thanks, Erin. So I hope that by providing these examples, you're all able to see that when we talk about life course vaccination, we're talking about opportunities where we can really look at delivering vaccines across the life course to everybody. And one particular area that is quite important at the moment and was highlighted quite a lot during the beginning of the COVID-19 pandemic is our health workers. Our health workers are really important to us. They work very hard, and we need to ensure that they are protected, because if they're not protected, then we also face issues with lack of health workers if they're out sick. And we don't want them to be impacted because they didn't get protected by vaccines. So one aspect of health workers is really important to think about is that they have a dual purpose, a dual role. They give vaccinations, but they also receive them. And in the European region, they have set out a strategy with 5 key strategies for successful engagement of health workers for both roles. So I think it's really important that I'm sure many people on the call will probably say that they're health workers who give vaccinations with no hesitation, and they also receive them with no hesitation. But we do also have health workers who may be hesitant sometimes to give vaccines and also hesitant to receive them. So given that these are the people that are at the front line and they're interacting with all our population, we need to ensure that they have the sufficient amount of information that they need to be confident about vaccines, and they need to be confident about also receiving them. So what the WHO European region, their strategy laid out that people continue to listen to health workers to understand what are the barriers and drivers. It's important that we motivate, support, and acknowledge the work that health workers do. And it's also important that we value health workers as a target group and also partner group, because they're a target group because they receive vaccines, but they're a partner group because they deliver the vaccines that we want our populations to receive. Also, it's very important that we engage workers as active agents in shaping the vaccination effort. And what we mean by that is these people are communicating to our populations about the importance of vaccines. So that in turn should help build health worker confidence, skill and knowledge. And once they have that confidence, they will also share that with the people that they're interacting with. So I think it's really important that we think about health workers as a very key target population that we should ensure are vaccinated. And on the next slide, we'll see that WHO provides vaccination recommendations for health workers. So here are a list of some vaccines. It doesn't include COVID-19 because I think we know that that will be added probably in the future. But just say there's a list of vaccines here that are recommended for health workers. And by ensuring that our health workers have protection against these diseases, it means that they're protected. And then also we have to think about that health workers also interact with sick people. So if our health workers are sick and they're interacting with sick people, that also has a knock-on effect as well. So it's important that we protect our health workers and we ensure that they have got the sufficient protection that they need. And also as part of that, the documentation and reporting is also an important part. In many countries, they have requirements for health workers to show evidence of receiving certain vaccines in order to gain employment. So these are policies that some countries have put in place, and over time we may see this happening more often, but I think there's a lot of work that needs to be done in this particular area. We go to the next slide. I want to let you know that there's a guidance coming out very soon about implementation. It's an implementation guide for vaccination of health workers, and what this guide covers, it gives you an overview of the global recommendations on occupational health and safety, and also some recommendations for vaccination of health workers. It also provides a policy framework for vaccination of health workers, strategies for vaccinating health workers, and also a chapter on how to build confidence and demand, as well as monitor vaccination amongst health workers. So I hope that by providing these examples, it gives you an idea of, I suppose, the thinking that is happening around expanding vaccination beyond infancy, thinking about how we can establish platforms, how we can integrate with other programs to deliver vaccines and consider specific target populations. So with that, I go on to the next slide and I'll pass it over to Aaron.
Thanks so much, Laura. And thanks for walking us through the life course approach. And I'll be talking about the integration approach, the other half of the key strategic framework here around life course and integration. The next slide. So we're going to turn to the chat here for this question. So what do we mean when we talk about integration? Go ahead and put in the chat what you think integration means. We'll see what people say. I see one door system, kind of one-stop shop, everything under the same umbrella, combining with services, incorporating onto existing services, collaboration, combination, harmonization, coordination. It definitely sounds like there's a lot of level of familiarity in general with the integration approach here, which is great to see. You know, this is certainly one aspect of the work that I'm sure you all do on a daily basis is coordination and so forth on the integration side. All right, excellent. We'll jump into this on the next slide. So in 2008, put together a working definition for integration. You can see here on the left side, the technical brief that was put together on integrated health services. So as WHO defines it, it's the management and delivery of health services so that clients receive a continuum of preventative and curative services according to their needs over time and across different levels of the health system. Now, this is certainly something that you all have touched on in the chat in your answers in terms of provision of multiple services, provision in the best way possible for the beneficiaries or the clients coming in for health services. And I think what we really want to be able to note here is that integration is not really a yes-no situation, but this is a strategy upon which many countries and many health systems really sit on a spectrum, where you have health programs that may be much more vertical, as we call it, where they're very focused on a single disease and eradicating that given disease. And then there's, on the other end of the spectrum, the ideal of a primary healthcare system. And a primary healthcare system has really very much at its core the integrated approach. Move to the next slide. So what is the potential benefits or the rationale for integration within the immunization context? There's actually many different reasons or rationales for considering integration in the immunization context. Now, immunization visits, as recommended by countries, overlap with many other scheduled interventions that are trying to reach the same target populations as immunization services, oftentimes children, but also mothers, pregnant women, now adults, adolescents. And so you can see, as an example, there is this schedule overlap that can occur between immunizations and other maternal and child health services, such as vitamin A supplementation, deworming, distribution of bed nets. And so this is one rationale for integration. The second rationale for integration is that over the past 30 plus years, as routine immunization services have become very well established in most countries, it's really become one of the strongest platforms for provision of a health intervention, really being able to reach in many countries beyond 80% of their intended target population, which in particular tends to be those individuals who are under 2 years of age, infants and young children. And so because of this high reach and the high equity also that many immunization programs have managed to achieve, it's seen as this ideal platform that's a very strong platform upon which to add additional MNCH interventions that are trying to reach the same target populations. Immunization also can become a contact point for the individual that's bringing in that child to also receive health information too. And that health information may be about the availability of other health services and referrals for that individual, say to family planning or to HIV testing. So that's another key rationale too. Now, another piece, and Laura talked a lot about this in the life course approach, is that the integration of immunization with other services can really be and is a fundamental part of the life course approach, in that it really can facilitate delivery of both immunization services as well as that other maternal and child health service across the life course. And so with many countries moving towards the provision of immunizations beyond early childhood, for instance, there's this opportunity for integrating or linking immunization services with those existing maternal and child health visits that are already in place. Looking back at that Ghana example, for instance, where they took advantage of existing growth monitoring visits, and they were able to integrate into that visit and thereby make it stronger together for both immunization services as well as nutrition and growth monitoring services too. The integration of immunizations also contributes towards the stated comprehensive approaches for disease control that are laid out for many vaccine preventable diseases. We have HPV as an example. We also have pneumonia and diarrhea that there are vaccinations for, but there are also comprehensive approaches that have been laid out for controlling these different diseases that include not only vaccination, but also other interventions such as breastfeeding, nutrition, reducing indoor air pollution, and so forth. And so immunization together with these other health interventions will help us to achieve very reduced levels of many of these different diseases that do have a vaccination available for them, but vaccination alone will not achieve low levels of mortality and morbidity for that given disease. So we need that comprehensive approach, and thereby we need that integrated approach. And then lastly, the final rationale reflects this real need for us to be working across sectors, to not just be thinking about our immunization program, but also be thinking about the other health interventions and health programs that are in our ministries of health, and even beyond the health ministry to the ministries of education and so forth, to be able to show that we can further improve immunization services and other essential health services by linking better with the existing health and development strategies and interventions that are in our countries. And that multi-sectoral approach is addressed in part by having a more integrated approach. Next slide. There's different objectives that we oftentimes want to aim to achieve when it comes to integration. And it's also speaks to the broad definition that is in place for the word integration. So when we talk about integration, we may be thinking about how to just broadly strengthen our primary healthcare system. So for instance, there's oftentimes the use of the word integration when it comes to health supply chains and linking together vaccination supply or vaccine supply chains with other health commodities to build out a more integrated supply chain. Having a integrated health information system, for instance, I think many of you have probably been connected to your country's health information systems that are based on these much more integrated information systems, not just about immunization, but now about being able to monitor across many interventions. And so that is certainly one objective when it comes to integration. Another definition or objective for integration as well, as I touched on it in the previous slide, is this comprehensive approach to addressing specific diseases such as pneumonia, diarrhea, HPV, where you cannot just do vaccination, but you also need to implement a number of other health interventions to be able to holistically address that given disease. And that's a really critical part of many of the objectives that are needed to be achieved by countries in terms of reducing disease mortality and morbidity. And one good example I mentioned earlier was around this comprehensive approach to reducing mortality and morbidity from pneumonia and diarrhea. There are around 10 or so recommended interventions that need to be put in place to comprehensively address those two diseases. And vaccination is included, the PCV or pneumonia vaccination vaccine, and then the rotavirus vaccine. But there also needs to be in place clean water and breastfeeding, good nutrition, and various other recommended interventions. And so this comprehensive approach is another key part of the objectives of an integration strategy. And then lastly, there's a big objective around better serving particular target populations. And many of you mentioned this in the chat, how we are aiming in the integration strategy to be able to provide a more efficient, more comfortable, higher quality service delivery experience for the clients, for the beneficiary, where if the parents, if the child is coming in and can receive all services for which they are eligible, and the health system is set up to be able to do that, then there's a key opportunity here for having higher levels of trust in the health system, for having the ability to more efficiently deliver services, not only for the healthcare provider, but also for the caregiver, who then has reduced numbers of visits that they need to make to the health facility. And then lastly, integration along the life course, which Laura talked a lot about, is the approach here of really being able to holistically address clients' health needs over time, such as through various strategies, IMCI, where if a child is coming in and they are a sick child, that they're screened to understand what other health services could they provide. The addition of vitamin A alongside routine immunizations is a real key strategy. Vitamin A is a recommended part of many comprehensive health packages within which many vaccines sit as well. Next slide. So how can integration help with the COVID-19 recovery for your immunization program? Let's go to the next slide and talk about this. So integration very much is this strategy that encompasses the two big objectives here that we are addressing here in the fellowship, which is around closing the immunity gaps and recovering immunization programs. We know that it's not just immunization services that have been highly affected by the COVID-19 pandemic. It's all essential health services that have been affected. And the integration approach helps us to achieve and much more efficiently use resources to be able to strengthen all of those essential health services. And realistically, it helps us to, in the conversations we have with other Ministry of Health and Ministry of Finance officials, be able to have a rationale for addressing these immunity gaps and recovering programs if we lay out a more integrated approach that's addressing not just immunizations, but perhaps is also addressing gaps in vitamin A coverage and deworming coverage, bed net distribution coverage, then that potentially is a more appealing strategy from a financial perspective for others within the government. And then it also encompasses being able to strengthen routine immunization and build resiliency by being able to further incorporate routine immunization into the primary health care approach. we are essentially achieving the objectives that are laid out for why we would be integrating, the rationale for integrating in the first place. And this will further strengthen the routine immunization program. Next slide. Now, we have seen in the past 2.5 years that with this interest in being able to recover many essential health services, not just immunizations, that the high coverage that immunization programs have been able to achieve in many countries has really stimulated an increased interest in the integration approach. And it's why it's a key component of the Immunization Agenda 2030 for the next decade. And this is a big opportunity. You can see here in the graphic, the gaps that exist from many other essential health services next to the highlighted immunization services. And so even though in many of our countries, coverage has slipped a bit for vaccination, there is still a big gap that's there for immunization services versus other essential health programs. And we have this big opportunity for bringing the two together if we are able to focus in and highlight the need for a more integrated approach. Next slide. As this was discussed in the last webinar, integration can also help us to achieve reduced levels of missed opportunities for vaccination. I'm not going to go through all the different examples of reasons why we have missed opportunities for vaccination, as this was highlighted in the last webinar. But one of the key things to hone in here is on the left side of the slide, which is around reasons why we have missed opportunities for vaccination, is this lack of integration, in particular between curative care services and preventative care services, but can also exist between different preventative care services. And so the real challenge here and the opportunity is how to be able to ensure that when a child comes in for other health interventions, whether it's because they're sick or because they're coming in for a growth monitoring visit, how do we ensure that they are screened for their vaccination status, and then they're provided vaccinations if they're eligible for it. And even if they're coming in and they're accompanying their parents who's coming in for their own health intervention, we should be able to also incorporate an opportunity to screen that child on their own vaccination status and be provided an opportunity to be caught up on any earlier missed vaccinations and be provided any other recommended vaccines for which they're eligible. So integration is a real key underlying element of this opportunity for reducing missed opportunities for vaccination when you link across existing health services within a health facility. Next slide. So I'm going to walk through a couple of examples of integration. Next slide. Laura touched very much on this. I'm going to spend just a bit of time on it. You'll see laid out here the different age-based platforms that Laura described, and how at each of these age-based platforms, there is an opportunity to be able to incorporate many other maternal and child health interventions that you see listed here at the bottom. And this helps us to support the broader concept of a life course approach to health, of a universal healthcare goal, and of building out a primary healthcare system. So one needs to keep this in mind, that as we're building out a life course approach to immunization, we actually have this big opportunity, if we look at it from an integration lens, to build out a life course approach to health. Next slide. Now, from Laos PDR, we have this example here that shows on the vaccination campaign side, so far we've been talking about routine immunization, that we have this opportunity to reduce our financial costs for providing vaccinations and other maternal and child health interventions if we take the integration approach. In this example here from Laos, we see that there was a initial strategy around having a standalone immunization and vitamin A supplementation campaign, and then a second deworming campaign that was planned. And if the deworming campaign had been planned by itself, it was going to cost around 23 cents per treated person. But when they integrated the two together, so now they had one campaign providing immunizations, vitamin A supplementation, and deworming tablets, it reduced the cost to 3 cents per treated person for delivery of that deworming tablets. And so it was a much reduced approach when they had this integrated campaign from a financial perspective. Next slide. So I just want to point out here in terms of the campaign integration topic and further information around the costs, that there is a set of work that is being pulled together and is available at campaigneffectiveness.org. And it's under the Health Campaign Effectiveness Coalition, where they have been over the past couple of years pulling together all resources for how to plan integrated health campaigns, not just for immunization, but for all health interventions. And I suggest that you take a look at the resources that have been pulled together at this website. They're an excellent set of resources. Next slide. On the COVID-19 vaccination front, I wanted to point out one example here of the integration of COVID-19 vaccination with other health interventions. This is an example from Cambodia and the Clinton Health Access Initiative, where they took advantage of the provision of COVID-19 vaccination to also screen individuals as they came in for non-communicable diseases. And this actually turned out to be a very successful integrated intervention, and they were able to achieve a high proportion of those individuals coming in being screened, and then they were able to refer a high proportion of them that had high levels of blood pressure or had the potential for being diabetic to then be followed up at the local health facilities. So this provided a really nice example here of the work that Chai and the Cambodian Ministry of Health were able to do within the context of the COVID-19 vaccination rollout. Next slide. So just to lay out here quickly, the integration, I've talked a lot about the rationale for it and the good things that you should be thinking about in terms of integration, but I do just want to note too that there's these risks that can be inherent to integration. So I've talked a bit on the benefits side around how there's this potential for having higher coverage across all health interventions when you're linking a new intervention to immunization services, that you have this potential for better efficiency with health services by reducing costs, for example, with that Lao PDR vaccination campaign, that by providing multiple health services in that same health facility visit, that you have the potential for improving user satisfaction. And then you also lastly have the potential for increasing demand for multiple health interventions if you are using that vaccination visit to promote other health interventions and also to screen on vaccination status and potentially reduce missed opportunities for vaccination. But there are potential risks here. There is this possibility that you may impact overall coverage rates if the integration approach is not well thought out, and you may potentially impact both vaccination coverage as well as the linked interventions coverage if it's not planned out in terms of thinking about the increased workload for staff, in terms of thinking about any sensitivities in the community around provision of different health services alongside vaccination. And then this issue then corresponds to the other risks that are laid out here. Sometimes staff have concerns about the perceived higher workload or additional responsibilities that may come with the integrated approach. And so one really needs to think through what kind of issues may arise from staff now providing a set of health interventions as children and other individuals come in. And then lastly, clients may not accept the integrated service approach. And this again is where it's really helpful to be able to go into the community and understand if we do this type of integrated approach where we are providing both vaccinations alongside referral to other health services or provision of other health services, could that potentially result in a reduction in coverage because certain services have stigma associated with them, and so the clients may not want to see those services be integrated together. Next slide. So the last on key considerations before integrating that are related to the intervention, you really want to be able to make sure that there's similar target groups for the other health intervention as routine vaccination. You want to be able to look at the recommended schedule for the other health intervention and see how well it aligns to the routine vaccination schedule. You want to be able to look at what are the logistical requirements for that other health intervention and whether it's as straightforward or simple as vaccinations. You want to be able to understand the level of existing level of acceptability within the community for those other health interventions and for linking together these health interventions. And then lastly, you want to be able to examine what kind of skill level is going to be needed for provision of that other health intervention and what kind of capacity building may be needed for your existing health workers who are providing the vaccinations and whether they're going to need to be trained up and prepared for provision of this other health intervention. Next slide. And then lastly, the considerations related to the health system context. There's certainly a big need for being able to address at the political level, the level of acceptance with an integrated approach. One needs to look at the policies that are in place to be able to support the integrated approach, and then that those policies flow into updated healthcare provider guidelines that can support healthcare workers with implementation of an integrated approach. One also needs to make sure that there are supplies and funding available for all of the commodities that are needed across all of the linked health interventions so that healthcare workers can actually provide both interventions at the same time. And that healthcare workers are essentially their work plan, that their SOPs are set up to be multi-purpose, that they are not being funded solely for provision of one intervention. Next slide. I'm not going to go through this checklist, and I'll make sure that we get this linked here and out to all of you, but this integrated service checklist is essentially a bit of a way to compare one health service to vaccinations to see how well could these two services or multiple services be linked together. And this comes out of the Working Together guide, which is the official WHO guide for the integration approach. And this service checklist is there in the annex, and it's a great resource for being able to start walking you through how to approach the integration topic in your country. Next slide. All right. I think I'll turn this back over to Liz.
Great, thanks so much, Erin. And I think now we just wanted to address some of the questions that have been coming through in the chat box. So again, appreciate all the questions so far and continue to ask them in the chat box. I know that we have a few that I think have been selected to share out, and I might turn it over to my colleagues Jill, Milt, and Samir to maybe ask the first set of questions.
Yes, hello everyone. So the first two questions are quite related, and they were asked during Laura's presentation. A question from Patrice Alice Quadrago from Canada, and the question was about, can you talk about the importance of logistics in life course vaccination? And also a related question asked by Dr. Tanveer from India. What measures were taken to check for continuous supply of vaccines and other logistics related to it? I think that question was asked when the case example of Ghana was being discussed. Over to you, Laura and Erin.
Thanks, Jamil. I think that the point about logistics is really key, because once we begin to expand vaccines across the life course, that means that we're targeting more populations, we're trying to reach more people, and also we may be reaching people differently. So we may not be going through our routine immunization services, but in some countries, they may be delivering vaccines through pharmacies or through other contact points. So I think that the logistics part is key. And I think I was noticing in the chat that also, some of the points people were making was also about not knowing the number of the population or the target population. So that goes very hand in hand with your logistics, because you want to ensure that you know what population you're targeting. You need to know what the number of your population you're targeting. And then when it comes to logistics, then this adds complications, because we may have some areas that know what they need and other areas that don't know what they need. And then also the storage issue is also something that comes up. When we have greater increase of vaccine, then we greater demand on our storage. So I think the two kind of interlink in terms of supply and logistics, that you need to have good systems in place to ensure that you can track your supply and demand of vaccines, and that the distributions are put in place, and that you're able to follow and see where there are areas that are lacking and where areas that are maybe have oversupply. So I think it's very, very important that we focus on these aspects. But just to say that in many cases, when we look at what happened with the introduction of COVID-19 vaccination, the same channel was used for logistics. So it's an integrated approach. But I think the most important thing is that, we understand what number we need and where it needs to go. And that really comes down to communication coming from the health facility, district level, or to subnational to national level. I think that's going to help with that. And then in terms of supply for the Ghana 2IL project, I'll pass it over to Erin.
Sure, thanks, Laura. To add on to that, I think for Ghana, they do have a very strong health information system and a very strong feedback approach through routine supervision and being able to monitor the any sort of stockouts that may be occurring across their vaccines. So this was their approach for being able to monitor the availability of vaccines across the health facilities there. And this was something that certainly was identified as they were introducing a second dose of measles, the need to be able to ensure that they had a sufficient supply of measles containing vaccine in the country. So yeah, I mean, that's basically the takeaway for Ghana.
And I just want to mention that in session 5, we have coming up in a couple of weeks, we'll be covering comprehensive session planning, which will also touch on the logistics and supply part.
Liz, how are we with time? Do we have time for another question?
We have time for one more question.
Okay, well, I actually have a group of 3 that are similarly related. So we had a question from Dr. Ifono in Guinea. Isn't scarcity of resources an obstacle to the integration of services, given that this strategy requires more highly qualified human resources? And then a comment from Thomas Bolochi in DR Congo. The translation of the comment is, integration is a good thing, except that the actors on the ground tend to privilege some activities to the detriment of others. And this requires sufficient human resources, but some health trainings are managed by one person only. And then another comment from Kama Nanatena from Togo. Integration reduces costs. The problem is more about acceptance of other programs to do integration and human resource training. Over to you.
Yeah, thanks, Samir. I think that the points that are raised by the participants here are really critical ones here. I think the scarcity of resources is something that's a very real situation for many of you, and is certainly an obstacle to service integration. I think this idea here of countries existing along a continuum when it comes to integration is in part because of this limitation around resources. I think there are certainly things that can be done from an integration standpoint that are not financially intensive in the sense of being able to, for instance, incorporate something as simple as the screening of a child that's coming in on a non-vaccination visit to see if they are eligible for any recommended vaccines. And that is one example of integration. I think we often think about service integration at a very big level in the sense of combining one big health program like HIV testing and screening with another big health program like immunization. And how do we have this integrated delivery in a single vaccination visit? But I think we should really think about the things that are actually a lot simpler and can be done in many contexts. And that the resource, yes, the resource needs will always be a constraint when it comes to it. And we will have to wait and be patient as more resources become available for providing, say, a comprehensive package of interventions. But I do think like there's certainly what we might call low-hanging fruits on the integration side that can be achieved here. And I'll address the one other thing that's highlighted here around this, the actors on the ground and privileging certain activities to the detriment of others. I think this is something that is certainly very real and is something that is even driven from a global context. And there's a recognition that this is a challenge here and something that everybody at all levels has to be addressing when it comes to, say, doing so on the chat, doing a polio vaccination campaign that's very focused on polio. I think there's these opportunities and there's a global level of thinking already in place around how do we do better when it comes to implementing a fairly vertical program in terms of the integration approach. And I think we need to keep focusing on that and realizing that that's something that's can be detrimental to other health interventions. So I think, realistically, it's not something that's easily addressed, but it is something I will say from my vantage point is we're trying to address slowly but surely. I think I'll turn it back to Liz, perhaps.
Great. Thanks so much, Erin. And thanks everyone for your questions in the chat. So I know that we're at time. I just have a couple more slides that I do want to get to. One is this reflection question that you see posted on the screen. So this is a question that we'll be posing in the Boost Learning Group forum section. We'd appreciate you responding to it in advance of the next session. So the question is, which aspects of the first two sessions are most relevant to you for recovery of an immunization program? Again, we'll be reposting that question in the learning group, and we'll share it out in the follow-up email as well. Next slide. And just a reminder, our next session will take place again next Wednesday at the same time around reducing zero-dose children. Next slide. And again, just showing the upcoming topics. Next slide. And great, these are all just the reminders which will be sent out again via email. We do encourage you to take our post-session survey. Again, you'll need to be to complete this in order to record your attendance of these mandatory live sessions. And again, we'll be sharing out all these links via email, but do encourage you to visit the Boost Learning Group and also add our Telegram channel so you can get timely reminders. I think with that, I know we're a little over time, so I just want to thank all of our facilitators for today's session. And again, thank you for taking time out of your busy schedules to join us for this fellowship. Great, well, we'll see you next week. Thank you, everyone.